Hello, I'm Talmadge, Dean of the UCSF School of Medicine and Vice Chancellor for Medical Affairs at UCSF. Welcome to the second edition of Under the Microscope, a new series in which our amazing UCSF alums share their perspectives on trending topics in health and science. We are focusing the Under the Microscope series on a topic that is top of mind for UCSF and its alum: the future of healthcare. Advances in technology and data science continue to shape the healthcare landscape and how we detect, diagnose, treat, and prevent disease. Across fields of practice, we see profound impact, the tremendous potential of tools like digital imaging, artificial intelligence, genomic sequencing, machine learning, and other technologies. Our guest today has fully embraced a tech-forward approach in advancing the field of mental health. Dr. Connie Chen is the Chief Operating Officer at Lyra Health, a behavioral health technology company that helps companies improve access to effective mental health care for their employees. She is responsible for clinical product, clinical operations, and research at Lyra. Previously, she was the co-founder and chief medical officer at Vida Health. Dr. Chen graduated Phi Beta Kappa and magna cum laude from Harvard University with a degree in economics and a certificate in health policy. She completed her medical education at UCSF in 2012 and her internal medicine training at Stanford. She has published on open frameworks for mobile health, as well as use of comparative effectiveness research design in leading medical journals. Welcome, Dr. Chen. Thank you for being here.
Thank you. I'm so excited to have this time.
So before we sort of delve into the future, I'd like to ask you to look back at your time at UCSF. How did UCSF support your aspirations and help your career develop?
It's a great question, and funny. I was reflecting on my time at UCSF, and I think it's great to rewind the clock to before I came to UCSF, which was, I had no knowledge or interest in technology. So I give UCSF and my time there full credit for setting me on a very different career path than I would have ever imagined. I did not land at UCSF thinking that one day I would start a digital health company and become a leader at another one, and that virtual care would become such a dominant care model. But I really credit a lot of my mentors, a lot of the industry connections I made while at UCSF, and a very unique student community across both the School of Medicine, but a number of the other PhD programs, in terms of creating a really supportive environment to explore what was then kind of a new thing. I remember when I was a medical student, it was just a couple years after the iPhone had come out. And, we were, as students, kind of going through our rotations, but also, just talking over lunch, like, what would the future of healthcare look like with this device as an enabling tool? And it seemed so radical at the time, but I think so many things have played out that are just part of our daily lives now. Yeah.
So you're a big advocate for technology in the field of mental health access. So what's exciting you right now? What's piquing your interest and driving how you and your company are proceeding?
Yeah, there's so many challenges as it relates to mental health care, but I really think about two big areas, and I would characterize them as access and quality. Access is a big problem in all of healthcare, but in mental health, it's particularly problematic. So I think roughly about 20% of all Americans will experience mental illness in a given year. And the statistics are really heartbreaking. About 50% of people will never get treatment. And delays in accessing treatment are generally up to 10 years. And that really goes back to the fact that there's just not enough mental health clinicians in this country, and it's really, really hard to get care. And we've seen technology be really, really enabling as it relates to helping people close the access gap, but also access high quality care. I could go on and on about how this plays out and where technology really has an impact.
Yeah. So in sort of watching what has happened during the pandemic, we've seen a bad side of technology related to some of the sites out there that young people are connecting with that have sort of worsened the situation with them. I wonder how you all are thinking about, so you're talking about the good side of it, and then there's the bad side of it. How's the company thinking about working through both sides of this and helping it work? I think, is there a conversation that's going on at that level in the company?
Yes, of course. I think one of I started at Lyra as the chief medical officer, and one of the key roles of the chief medical officer is to be the clinical standard bearer and to carry the clinical North Star for the company. And one of the things that really drew me to Lyra Health was that commitment to evidence-based care that was really foundational to the company's founding, but also a deep commitment of our CEO, David Ebersman, who actually spent a lot of his career at Genentech, where obviously another company with UCSF ties and very tied to evidence-based care. So the industry really needs to hold itself to a high standard. And I think it's important for places like UCSF to be part of that, right? So the types of things that are really important are, who are the clinicians that they're hiring and what type of treatment protocols are the ones that are espoused by the company, right? So a big focus of ours at Lyra is evidence-based treatment into mental health. So one of the really interesting things that is different about mental health care than actually where my training background is, which is internal medicine, which I think is a very evidence-based field, is that practice of non-evidence-based treatments is very widespread, right? So the American Psychological Association actually maintains a database of commonly practiced psychotherapies in the community, and only about 20% of them have the type of randomized control trial data that we would expect in modern medicine, right? So at Lyra, that's been a really big focus of ours in terms of using machine learning as well as provider-facing software tools to make sure that clients are really getting high quality evidence-based treatment. The other part of that is just the type of thing that academia has really always led in, right? Which is really participating in peer review and the opportunity to both contribute to clinical research and science, but also make sure that third parties are brought into the fold to really validate the claims and the care that's being delivered. To your point, not a lot of companies in the space are not doing these things, but I think as we move into this type of care being widespread, those are critical to making sure that we don't provide access without quality, right? Especially in mental health, it's a tremendous act of courage for a patient to seek care. There's a lot of stigma, and the worst thing would be for them to start care in the wrong place.
Yeah, finding the right place for the right patient at the right time has been one of the things that's interested me for throughout my career, and it's really difficult work. So I really applaud you all in trying to figure out how to make that decision and how to make it real for people, because mostly I find that people think that the answer is the neighbor across the street who had some healthcare that was totally unrelated to what they're talking about, but they follow it. So I'm curious, as you look at where you'd like the outcomes and impacts that your work has, where do you sort of see it having the most immediate impact or of making a difference?
I really love that you called out triage, because I think there's a bunch of buckets where technology can have an impact, but a lot of times people focus on the care itself. And I think there's a lot of opportunity in mental health to transform the care itself. But I'll start by addressing what you talked about, which is triage, which is actually where Lyra started, which is one of the insights that we had as a company was that it was exactly your point, which is not all care is made equal as it relates to quality of care, specialization of the provider. I think that's something that's not really widely known in mental health. It's just like other parts of medicine. A lot of providers specialize, and if you knock on someone's door and they don't treat anxiety, but they focus on trauma, that's going to be really annoying as an experience for both the patient and the provider. So really connecting people to the provider who has the best chance of getting them better based on, geography is important, travel's annoying, but specialization, clinical quality, clinical value. So I think there's huge opportunity for technology to help people get to the right place right out of the gate, because getting people to the wrong place is just inefficient for the healthcare system. Those are wasted appointments, and that's a delay in treatment. And there's the risk that the client just falls out of care and doesn't come back. I think after triage, the opportunity that is probably more widely known, and I am super excited about, is the care itself, right? So I think technology really can play two types of roles as it relates to transforming care. The first is what I always characterize as linear transformations, right? So this is what you would imagine as like a video visit. Is a video visit fundamentally different than what you do in person? Not really, especially in mental health, where the physical exam is less of a big thing, right? You're just kind of porting something from the doctor's office to your home. Where I'm really excited about is what I describe as step function change. So what are the places where you can use technology to kind of reimagine the care model, right? So one of the things that's really interesting in mental health is that historically, psychotherapy has been very session-based, right? You go see your therapist, you sit on the couch for an hour a week, and that's the treatment model. But the reality is that most people live their anxieties in between the therapist visit, right? You probably feel better in the moment that you're there in the therapist office, and the moment you leave, you're back to kind of confronting all the challenges of your life. And the other part of most evidence-based treatments is it requires you to really practice the skills the therapist is teaching you about how you change your thoughts, change your behaviors, and modulate your emotions in your everyday life. And historically, the way that was done is you go to the therapist office, they give you like a worksheet on paper, and they tell you to write in it during the week. And very few people did that, right? With technology, what we've been able to do is really shift much more of the care to that in-between session care model, right? So you do this, you go to the video visit with your therapist, but you spend a bunch of time in between those visits completing homework that the therapist is assigning you on a digital platform, messaging with your therapist. That way the therapist is in the loop. They know what's happening during your week, and they can really help you in terms of applying those skills to your daily life, to your relationships, to your work challenges, to your personal challenges. And what we see is that treatment model is much more effective. It's taking sort of the type of treatment that was like gold standard in the literature, but really never practiced in the community, and enables us to scale that. And that gets to another really big opportunity of technology, which is to scale providers, right? It's really expensive and takes a lot of time for places like UCSF to train excellent clinicians, right? And we just can't keep up with the clinical need. So technology allows us to really make the time providers spend much more efficient. So with this care model that we at Lyra call blended care, which is in session and in between session care, we take what's traditionally an 18-session CBT protocol and drive even better clinical results in about an average of 6 sessions. So the therapist can now see 3 clients for every 1 client that they used to see, which then also unlocks more access.
Yeah, so you touched on several things that really piqued my interest. And I know that we don't have time to talk about all of them, but I'm chuckling to myself because I'm a pulmonologist, and until we got to technology that allowed us to learn what our patients were actually doing at home, we didn't realize that I would give them an inhaler to use for their asthma, and then we developed technology that allowed us to know exactly when they used the inhaler. And even though the patients knew we knew, they would only use it the day before they came in for the doctor visit, right? And so what you're describing is these in-between visits. Can we help you do what we think will work for you? Can we document that? And you have figuring out a way to do that actually improves care and lessens the impact in terms of communications between doctor and patient, because the patient is actually doing more of what was suggested and what appears to be working. Did I hear that right?
Yeah, I agree with you 100%. I was laughing at your story about patients, using the inhaler the day before the visit. We do see some of that as well. People do all their homework the day before the visit sometimes. But the other part of that is actually is also measurement-based care, right? So understanding kind of the functional impact of and the the symptomatology between sessions more clearly is incredibly helpful, right? Because I think for a lot of reasons, whether it's memory bias and other things, what patients report in a session, in a visit, may not be completely accurate as to what they're really experiencing in their lives.
Yeah. So I'm curious, as you look back on your experience at UCSF, you talked a little bit about, your lunch table conversations about the iPhone, but what things did you learn at UCSF that have been enduring, for you, and what things we at UCSF should start to do better to help our graduates be successful in the future that you see?
So in terms of, I think, enduring principles from UCSF, I think there's really I've learned many more than three things from UCSF, but I think three principles that were really instilled in me from my time at UCSF that I carry forward and are really important to me as I in my career today. And I would describe them as the first being innovation and taking risk. Like, I really appreciated being at a place that is on the cutting edge like UCSF and seeing professors who were pioneering, new discoveries across all scientific disciplines. So the willingness and kind of seeing the potential of what healthcare and science can be in the future, that's different than it is today. So this innovation mindset being the first. The second is maybe the opposite of that. I would describe it as kind of a very humanistic mindset. One of the things that has been very enduring has been, I don't know if this is still around, the Foundations for Patient Care curriculum, right? Where you learn kind of doctoring 101 and kind of the humanity of the doctor-patient relationship. And that's something I deeply believe in. So one of the things in digital health that's where you'll see kind of two camps are folks who are more in the camp of technology only as the solution, versus my deep belief is that healthcare is a deeply human thing. And the greatest opportunity is for technology to enable providers and patients, but not to replace the provider fully. And I think that's a principle that comes from my days at UCSF. And the last is, I think UCSF is really special in terms of its commitment to equity. I think one of the greatest opportunities in technology is to create more health equity in terms of democratizing access to quality care. But it's something that as a company, you really have to be mindful of and really prioritize as something that is really core to your mission. And I think UCSF is such a leader in health equity. And I think I'm very grateful for a lot of the experiences I had for my time there.
Yeah.
In terms of what UCSF might do better, when I was at UCSF a decade ago, it felt like very early days for digital health. And, I will say, I recall some fun conversations when not just myself, but, I had a small group of friends with shared interests, and we proposed, spending our summers doing digital health related activities as opposed to more core clinical science or clinical education activities. And it was a bit novel, but I was grateful that people were willing to allow us to take the leap. And it's been fantastic to see UCSF build a bunch more resources in those areas. And over the years, I've had a number of students reach out, and it's been really fun to see students continue to engage as this is really the future of healthcare. So I'm excited that UCSF is really leading and being part of it.
So you describe in your background that your grandmothers, I think, were a big influence on you because of their entrepreneurship and the resilience and just grit. And the other thing you describe is you're from a family of scientists, physicians, and scientists. I'm curious, how do they think about you and your career? I'm sure they're really, really proud of you. I don't mean that, but so you are a tangent from, I think, what was traditionally in the family's background of work.
I think when I first made the decision to pursue a career in digital health as opposed to a more conventional or more traditional clinical career, it was surprising to my family. You know, they weren't really sure what it is, but I think they've also seen, obviously technology really transform healthcare in their own lives. You know, with COVID, many of them, you know, learned to practice telemedicine as well. So I think it's been fodder for a lot of fun family discussions. You know, I think our family discussions are already a little bit like grand rounds, but it's fun to now shift those to sort of like more like technology as a discussion topic.
Yeah, yeah. I always find, yeah, I'm the only physician in my family, and so usually our gatherings are diagnosing diseases I have no understanding of, right? But in your case, you have to describe technology that most people are just learning to use and make it real for them. So in closing, what is it that you would like to tell the current students at UCSF that you think would be helpful to them as they think about their future in this healthcare environment? Is there what thoughts sort of popped in your head about the future of healthcare and where we're going?
I think I'm very much an optimist. I think I think the future of healthcare will be one that is better than it is today, right? We'll have more therapeutics. It'll be a better experience for members to access care. It'll be easier to access care. Care will be better. I think these are all things that technology will enable. And I think I would really encourage the students today to really see themselves as leaders in that transformation. I think as you know, as a physician or as any medical professional, we have such a privileged role to take the expertise that we have through the years of training that we accrue, as well as the patient experience, and really help shape that innovation. I think the technologists are really hungry to partner with clinicians, and I think as clinicians, in some ways, you know, one of the questions I get asked most frequently is, you know, should I go into digital health? And it's really framed as this like either or, like if I go with the sense that if I go into digital health, I can't be a doctor or I have to make these big choices. And I really think you can do both. And I think that is the best path to do both. There's this really wonderful virtuous cycle in terms of seeing patients, and then taking that clinical knowledge and experience and translating that into innovation, and then kind of closing the loop in terms of thinking about how you can make clinical practice better. So that's a path that I've been a big fan of, and really encourage people to really see themselves in those roles and believe that that they can do both. And it's just such an exciting time for us.
Yeah, it really is. I said that was the last question, but it isn't. So you're very much interested to, you commented about telehealth and using technology and whatever. We're finding that in our environment, physicians, healthcare workers in general are also fatigued by all the technology. And I wonder if, and we're seeing a lot of burnout. I wonder, are there lessons that you all are learning that can help people overcome that and deal with in our setting, it's, you know, it's the electronic medical record and all of the notes and all of the contacts and trying to keep up with, you know, the emails and text messages and things like that. And I wonder, is that something that you all have started to think about and look at to see how you can address that electronic fatigue that people are?
Yeah. I think it's very real. I think as we shift to a world where more clinicians are spending 40 hours a week on a virtual platform, we will learn some new best practices in terms of how to reduce burnout. So an example would be in a traditional clinical setting or in clinic setting, oftentimes you might see patients back to back for 6 or 7 hours and then do all your charting at the end of the day, right? In a video world, I think that sort of model is more challenging, right? And when we've looked at our own data, makes it more likely and that you will feel burnt out, right? Because of just the eye strain. I think there's a lot of research about kind of the additional challenges of doing video-based care in terms of reading cues and that being taxing mentally for a clinician. So I think there's just, we have to evolve the way we practice for a digital world, right? In terms of how we chunk our time, how we schedule patients, like the workflow. The other part of it is really the responsibility of technologists, which is a lot of these tools, I think, were developed with the idea that maybe you would spend a small percentage of your time on them. And as really they become all consuming, this is what user researchers and usability specialists should be looking at as it relates to making the technology better, fewer clicks on every screen, really making it less burdensome. But it's not a perfect solution, right? So I think the problem that you're calling out is a very real one, and one that we need to be really mindful of, because as I talked about, we don't have enough clinicians today. And if we burn them all out and they all, retire early or change careers, we'll be in a really tough place.
Yeah. So I really appreciate this time that we've had together. Congratulations on an outstanding career. I think that the work that you and your company are trying to accomplish will be really helpful to us. This is a huge problem, dealing with mental health issues, and if we can find solutions that help improve the lives of our patients, that would be fantastic. So congratulations on all the work that you're doing, and thank you for sharing your views on the future of healthcare. So to all of you who have tuned in today to this edition of Under the Microscope, thank you so much, and be well.